This video is all about beginning therapy with Myofunctional Matters. I'm super excited to have you or your child as a patient here. You will either be seeing myself or one of the associate therapists for your therapy sessions. We decided to create this video to go ahead and give you some great tips on how to make therapy successful and also take care of a few housekeeping things so that on our first session we can concentrate on therapy. Let's jump right in. First, you will receive an email with some consent forms. Please sign and read all consent forms prior to your first session of therapy. All consent forms are required in order to begin, with the exception of the photo release. We at Myofunctional Matters occasionally use patient photos, videos, or treatment in order to inform other patients or even other providers about myofunctional disorders. We would greatly appreciate the opportunity to be able to use your photographs to help others, but we also respect your privacy. So if this is something that you would rather us not use or not publicize, just leave that form blank. Again, we appreciate any opportunity that we have to use those, but this is totally a personal decision, and we will respect your privacy if you choose not to share those. Next, appointments or sessions. So we at Myofunctional Matters run a very tight schedule. Your therapy session will be scheduled on our book for 30 minutes. We do expect that you show up promptly to your appointment at your appointment time, as we can always promise that we value your time and we will be on time for your session. If patients are more than 10 minutes late, please know that you have forfeited that session and we will assess a broken appointment fee of $50. We don't really want to do that, but we do have to do that in order to protect our time. If we get very behind on one patient, please know that that will make us behind for every other patient that day. We do respect your time. We always want to be on time for your appointment, and we ask that you be on time also. In the event that you need to reschedule an appointment, please know that we will always work with you to make a more convenient time if your current session is not going to work with your schedule. We do ask that you give us a 24-hour notice for that change. If by chance you do not give us that 24-hour notice or you totally no-show for your appointment, we also will assess that $50 broken appointment fee. This is just to assure that our therapists are using their time for the best treatment of patients. And so if we have reserved that time for you, we do expect you to show up on time. And if not, then we would love to have that appointment time to offer to another patient. Unfortunately, this is one of the things that we really hate to have to deal with when we're talking about scheduling appointments. But if there is an event come up and you do need to change your appointment, please know that all of us here at Myofunctional Matters are rational human beings, and we do know that emergencies arise, and we will decide this on a case-by-case basis. But please prepare yourself that if you do not give us notice to change your appointment, we will assess that broken appointment fee. So some special consideration if you have a child in therapy. If your child is in therapy, please know that you being part of their therapy is an integral part of their success. All children need parental guidance during therapy. So during your child's session, we would appreciate if you would be close so that you can hear. And if you have a very small child in therapy, please know that we will actually be teaching you the therapy techniques, and you will be doing this with your child every day. If your child is only doing therapy with us during that 30-minute session, I can promise you they will not progress, they will not see change. This will be something that you will have to ensure that your child is doing every day and that your child is doing correctly. So for very small children, we are actually teaching the parent how to do this therapy on your child. If you have an older child, say a preteen or a teen, you still want to keep tabs on what your child is doing, what expectations we have for your child, and make them accountable that they are doing their exercises every day and that they are doing those correctly. We will give you progress reports throughout therapy, kind of what they are accomplishing or where they may need more work. And we will especially be in touch if we feel like the child is not doing the therapy. So please keep that in mind. If you have a child in therapy, you will need to participate. We do reserve the right to discontinue therapy if we feel like a parent is not involved. The beginning of therapy is a really good time to talk about expectations. So we do expect you to show up to your appointment on time. We also expect you to have your kit at every session. And as far as therapy goes, we do expect you to practice your therapy. Ideally, you will do your active exercises twice a day, every day. That is the way that we can guarantee that you will progress and you will see changes. So it is something you have to commit to. One reason that we decided on a 2-week interval on therapy, particularly at the beginning of therapy, is to give you some leeway. We know life happens. There will be days where maybe you can't get your therapy worked in, and that is okay. But we don't want that to become the norm, and that can become a slippery slope. So we encourage all patients to work the exercises into their daily routine so that they will become habit. That is the best way to ensure that you are going to see change with therapy. So we expect you to participate. We expect you to do your exercises. And as far as what you can expect from us, so we're going to show up to every appointment. We are going to be very interested in how you're progressing. We all have a heart for all of our patients, and we only want to see the best. We won't change for you. And so we will do our best to keep continuing our education in order to provide the best therapy possible for all of our patients. So your therapy kit. You should have gotten this at your initial evaluation, or either we mailed this to you later. But please have your therapy kit handy for all sessions of therapy. There may be times where you may not need anything from your kit, but most of the time you'll at least need something. So be sure and have it handy. It will take up valuable time in the session if you're having to run around and kind of hunt things that you need for your kit. So always have your kit handy, and there may be times that we will also mail you out things that will go into your kit or go for therapy. So please make sure that we have your correct mailing address in the event that we want to mail you something additional for your kit. So let's discuss the flow of a typical therapy session. Most sessions, we will begin that therapy session with asking how you did with the prior week's exercises. We want to know if you had any trouble with any exercises. We want to know which exercises you found difficult, which ones you found easy. We also want to know if you did not practice your exercises. So if we see that what we gave you was difficult, or if we see that you did not progress, it can be a little bit of a false reading if you didn't practice. So please always be honest with us if you didn't get the chance to practice. We would rather know that than think that the skill that we gave was definitely too hard and maybe we need to back up and repeat things. So we always want to be very honest about that. But we generally start each session with wanting to know how you did with the prior exercises. So we appreciate any feedback that you can give us on that. And then we will start teaching the new exercises for the next session. So we will do those, we will practice those, and then once that appointment is over, you will receive an email where you will have all of the exercises written out with how many times a day that we expect you to do the exercise. Also attached to that email will be where you can go into the portal and see a picture of the exercise. So each exercise will have its pictures and the directions. So that way, if you feel like after the session you weren't exactly clear on how to do the exercise, or say it's a few days into the 2 weeks, and you're not quite sure that you remember you can always look at those photos, and that can help guide you. Now, if looking at that you're still not sure, we want you to reach out to us. Text, email, or call. Let us know that you need some clarification on an exercise. The last thing that we want is for you going the whole 2 weeks and you're not sure if you're doing it correctly. So please let us know if you want further clarification. We can always jump back on a quick video call, or we can even text a video of ourselves doing the exercise. Anytime you need that clarification, please let us know. Don't just sit and wonder if you're doing it right for the next 2 weeks. So some tech tips or telehealth tips. First of all, I really prefer for patients to use either a laptop or a desktop. Tablets are okay too. My last choice for doing the telehealth session is a smartphone, because the camera, the video on that is going to be so small. You're not going to be able to see me well, and you're not going to be able to see yourself well in that video. I do prefer a larger screen. I feel like that is always better. And as far as your internet connection, so most patients have high-speed internet, but please check your internet connection. Make sure that you have a connection that will support a video call. If you are on the call and you feel like your connection is not strong, always move as close as possible to your router. That is going to ensure that you're getting the strongest signal. A step above that would be if you can hardwire and directly plug into your router. That is going to ensure the absolute most strong signal that you can get from your router. So those things. Outside of that, tips as far as lighting. So if you are in a room with a window, you always want to be facing the window. You want the window to shine the light on your face. You do not want to sit with the window behind you. This will make your face very dark. The mouth and the face can be a dark place anyway, so you want as much light as possible. So in a well-lit room is ideal. If you can be in front of a window, that is ideal. And also you may want to just have handy a small flashlight, or if your cell phone has the flashlight feature, that will work also. But have a way that you can shine light into your own mouth. That way it will help me be able to see what you're doing really well. And always let me know if you cannot see what I am doing on video, especially well. You can always purchase extra lighting like ring lights and that sort of thing, fairly inexpensive off Amazon. So if you would want to purchase something like that, it would only help. The more light, the better. Let's talk about the spot. So the spot is very important in therapy. The spot is where we're going to want the very front of your tongue to learn to start sitting. And it is very important that you understand the exact location of this spot. So the spot is right behind the front teeth on the roof of the mouth. Ideally, we don't want the tongue pressing against the teeth. So the spot is back from the front teeth just a little bit. So there are a couple ways that you can find the spot. First, you can reach up with your finger. You can feel right behind the front teeth. You should feel a bump there. That bump is called your incisive papilla. And so where your tongue rests on the roof of the mouth can be actually on the back of that bump. So when you feel that bump, slide your tongue to the back of that bump, and there you are. You are at the spot. So that is one way to find the spot. The other way that you can find the spot is by saying the letter N. So when you say N, your tongue should reach up right behind your front teeth on the roof of your mouth. That is the spot. And I also like to show patients on a dentiform. So I'm going to cover up these two dots because we're not worried about those spots. But this spot in the middle here, right behind the two front teeth, that is the spot. So that is where we're going to want the front of your tongue to learn to sit. So anytime that we are in a session and we say, okay, on this exercise, you need to start with your tongue on the spot, that's where we're talking about. So we always want to make sure that each patient is confident and where the location of the spot is at. So along with knowing where the spot is at, we also want you to be aware of keeping your nose clear. So nasal breathing is super important at the beginning of therapy and all throughout therapy. Actually, for all of the therapy goals to fall into place, you must be able to breathe through your nose. So part of keeping it clean means blowing your nose, using nasal rinses, and we'll also teach you some techniques as therapy goes on to help keep your nose clear. So if you or your child experiences a lot of nasal congestion, please do your part in trying to keep your nose clear. It will only help therapy progress much easier. So that's all of my tips and tricks to help therapy get started. I know that you are ready to jump in, and we are too. I want to congratulate you on taking this step with your health. Myofunctional therapy has proven to be a very holistic way of restoring the body's natural function. We are excited to partner with you in improving your overall health, and we'll see you at your first session.